If a video told you baking soda can increase penile size, here's the truth up front. It cannot. And if you use it the wrong way, it can quietly worsen the exact thing you want to improve: your blood flow and erection reliability. In this video, I'm going to explain what baking soda actually does in the body, what it does not do, why people think it worked, and how misuse can backfire through sodium, blood pressure, and vascular stiffness. No hype, just physiology. This video is for medical education. It does not replace individual medical advice. If you have high blood pressure, kidney disease, heart disease, fluid retention, or you take medications that affect electrolytes or blood pressure, speak with a qualified clinician before taking sodium bicarbonate orally. Let's start with the core claim. Baking soda increases penile size. There is no reliable scientific evidence that sodium bicarbonate, whether ingested, applied topically, or used in baths, causes permanent increases in penile length or girth. To understand why, you need one basic concept. Adult penile tissue is not designed to grow in response to household chemicals. Penile size is primarily determined by genetics and developmental biology. Hormonal exposure during puberty influences growth and maturation of erectile tissue. Once that developmental window closes, the structural dimensions are established. In adulthood, tissues can change in function, meaning performance, blood filling, and rigidity, but not in structural size through topical powders or drinks. When people talk about growing size in adulthood, that typically involves medical devices used over long time frames, surgical interventions, or treatment of specific pathological conditions. Baking soda is not part of that conversation. So the first conclusion is clear. Baking soda does not enlarge penile tissue. Now, the next question is more important. If it doesn't enlarge tissue, why do so many men believe it does? Most men are not measuring anatomical size. They are judging what they see and feel during an erection. That matters because an erection is a dynamic vascular event, not a fixed structure. Erection quality depends on several systems working together. Vascular function. Arteries must deliver blood, and the erectile chambers must expand. Endothelial health. The lining of blood vessels must release signals that allow relaxation and dilation. Venous trapping. Blood must remain in the erectile chambers long enough to maintain rigidity. Nerve signaling. Sensory and autonomic nerves coordinate the process. Hormonal environment. Testosterone and other factors influence libido, responsiveness, and tissue maintenance. Nervous system state. Stress and anxiety can suppress the erectile response through sympathetic activation. When these systems are optimized, the penis fills more completely, becomes firmer, and maintains rigidity longer. That can make it appear larger because it is closer to its maximum functional expansion. But this is not growth. It is better performance. So when a man says, "Something increased my size," what he often means is, "My erection felt harder. I looked more full. I stayed rigid longer. I felt more confident." Those are real experiences, but they are changes in function, not changes in anatomy. Understanding this distinction is essential because it prevents you from chasing structural results using substances that can only influence superficial comfort or systemic balance, and sometimes in harmful ways. Baking soda is sodium bicarbonate, an alkaline salt. Its actions are primarily chemical. It neutralizes acids. That's why it has legitimate uses. In food preparation, it reacts with acids to produce carbon dioxide and leaven dough. In household cleaning, it helps with odor and surface reactions. In the body, it can temporarily neutralize stomach acid, which is why it has been used as an antacid in some situations. In medical settings, Sodium bicarbonate may be used for specific acid-base disturbances, such as certain forms of metabolic acidosis, always under clinical supervision and with careful monitoring. In sports science, it has been studied as a buffering agent that can reduce the impact of acidity during intense exercise. Even there, dosing can cause side effects, and the context is highly controlled. None of these uses involve sexual enhancement, none involve tissue growth, and none involve direct improvement in penile blood flow. Baking soda is not a hormone. It is not a nitric oxide booster. It is not a vasodilator. It is not a tissue growth agent. It is a chemical compound with narrow, defined roles. So how did it become associated with size and potency? Because online narratives often take a real substance and attach exaggerated claims to it, especially when the claim targets insecurity and promises control. There are several reasons a person might believe baking soda improved their size or potency, even though it did not change anatomy. Reason 1: placebo and reduced performance anxiety. Expectation changes physiology. If someone believes they have found a solution, anxiety can drop. Lower anxiety reduces sympathetic dominance, the stress response that constricts blood vessels and interferes with arousal. With less pressure and less fear of failure, erections can become more consistent. That improvement is real, but it is not caused by baking soda enlarging tissue. It is caused by the nervous system shifting into a state more compatible with arousal. Reason 2: improved comfort and hygiene. Some men use diluted baking soda baths or washes and experience less superficial irritation, less sweat-related odor, or less itching in the groin area. If discomfort decreases, confidence increases. Confidence changes arousal response. That can translate into better erection quality. Again, comfort influences performance. It does not change size. Reason 3: lifestyle changes happening at the same time. Many men who start protocols also change other behaviors, sometimes without noticing. They drink more water, they reduce alcohol, they go to bed earlier, they start exercising, they pay attention to diet. These changes improve vascular health, metabolic stability, and nervous system regulation. Then the powder gets credit. Reason 4: misinterpretation of short-term fluctuation. Erection quality naturally varies with sleep, stress, hydration, and arousal context. A man may have one strong week and attribute it to the most recent change. That's why any claim should be evaluated over time with attention to confounders, not based on a few experiences. So yes, a man can experience better erections during a period when he used baking soda. That does not prove causation, and it certainly does not prove anatomical growth. Now we come to the most important section: why using baking soda orally as a male enhancement method can backfire. When you ingest sodium bicarbonate, you're ingesting sodium. Sodium affects fluid balance, blood pressure, vascular tone, kidney workload. In many adults, especially with age, sodium sensitivity increases. Excess sodium can raise blood pressure and promote vascular stiffness. Why blood pressure and vascular stiffness matter for erections. Erections require healthy blood vessels that can dilate. The penile arteries are relatively small. That means early vascular dysfunction often shows up as erectile problems before it shows up as chest pain. When blood vessels become stiff or the endothelial layer becomes impaired, blood delivery to erectile tissue becomes less efficient. If you repeatedly add sodium load through unnecessary bicarbonate use, you can worsen blood pressure control, endothelial function, vascular flexibility. That undermines erection reliability. Kidney stress and fluid retention. Sodium increases water retention. In people prone to swelling, Fluid shifts can affect overall cardiovascular load. If the kidneys are already under strain, excess sodium can exacerbate issues. Kidney function matters for electrolyte balance and blood pressure regulation, both directly tied to erectile function. GI irritation and stress response. Frequent oral bicarbonate use can cause bloating, nausea, and digestive discomfort. Discomfort activates stress physiology. Stress physiology is not compatible with sexual performance. Sympathetic activation constricts blood flow and pushes the body toward performance pressure, which commonly worsens erections. Who is at higher risk? Oral protocols are especially risky for men who have hypertension, diagnosed or borderline, cardiovascular disease, kidney disease, heart failure, fluid retention, medications affecting blood pressure or electrolytes. For these men, the trade-off is not worth it. You are gambling with vascular health for a myth. To be clear, this isn't fear-mongering, it's mechanism. If you want better erections, you protect the vascular system. You do not add unnecessary sodium load in pursuit of size. External use is often discussed separately, and it needs clear boundaries. A brief, properly diluted sitz bath may help superficial irritation for some people. It may reduce sweat-related discomfort or odor on the external skin. But these effects are limited to the skin surface. They do not reach erectile tissue. They do not change blood flow. They do not alter erection mechanics. And excessive external use can cause dryness, disrupt the skin barrier, and increase sensitivity. So external use can be summarized like this. It may improve comfort. It does not improve size. It does not improve erectile tissue function. Overuse can irritate and worsen comfort. Many viral claims rely on the idea that alkalizing the body improves potency or performance. This is not how physiology works. Blood pH is tightly regulated by the lungs and kidneys within a narrow range. Significant changes are medical emergencies. You do not need spoonfuls of baking soda to fix pH. If your pH truly needed correction, it would require medical evaluation. Sexual function is not improved by manipulating systemic pH with household chemicals. Sexual function improves through vascular health, metabolic stability, and nervous system regulation. When a claim reduces complex physiology into a one-ingredient solution, it is almost always oversimplification. Now we move to the practical physiology. What actually works? If your goal is stronger erections, improved fullness, and more reliable performance, focus on the systems that control erection quality. 1. Blood pressure control. Chronically elevated blood pressure damages the vascular lining and promotes stiffness. Even mild hypertension can affect erections. Know your blood pressure. Manage it with lifestyle and medical guidance when necessary. 2. Glucose and metabolic control. High blood sugar damages nerves and blood vessels. Prediabetes and diabetes are strongly associated with erectile dysfunction. Check your glucose markers if you have risk factors. Address diet, movement, and weight. 3. Regular physical activity. Consistent movement improves endothelial function, reduces inflammation, and supports cardiovascular performance. You do not need extreme training. You need consistency. 4. Sleep quality. Sleep affects testosterone rhythms, stress hormones, appetite regulation, and mood, all of which influence sexual function. Poor sleep increases stress physiology. Stress physiology suppresses erections. 5. Nicotine avoidance. Nicotine constricts blood vessels. It directly opposes the blood vessel relaxation needed for erections. Reducing or eliminating nicotine is one of the most direct ways to improve vascular conditions for erection quality. 6. Stress regulation and nervous system state. Arousal requires a nervous system that feels safe, not evaluated. When men become hyper-focused on performance, the body shifts towards sympathetic dominance, which commonly reduces erection reliability. Practical stress regulation, better pacing, and realistic expectations can produce measurable improvements. 7. Medication review when appropriate. Some medications can affect erections. Never stop medications abruptly, but if you notice changes, discuss options with a clinician. Sometimes an adjustment is possible. These factors are not hacks. They are the foundation. And they work because they improve the system that erections depend on: circulation and neural coordination. So where does baking soda fit responsibly? Used for cooking, fine. Used for cleaning, fine. Used occasionally as an antacid in appropriate individuals, following product instructions and medical guidance, sometimes. External diluted use for superficial skin discomfort, possibly, with moderation and discontinuation if irritation occurs. What it should not be: a daily male enhancement drink, a size protocol, a topical enlargement method, an excuse to ignore blood pressure and metabolic health. If you want better sexual function, your primary target is the vascular system, not a pantry chemical. Baking soda does not increase penile size. It does not modify erectile tissue structure. It can be misused in ways that increase sodium load, worsen blood pressure, impair vascular function, and reduce erection reliability. If you want stronger erections and fuller functional expression, focus on circulation, metabolic stability, sleep, stress regulation, and appropriate medical evaluation. There are no shortcuts around physiology.